What do you do if you find an unconscious child at home? I'm Dr. Jovitra Pediatrician, and I'm here to tell you the steps for basic life support for a child above 1 year of age. The first thing to do is to ensure that your surrounding is safe for the child and for you. The next thing to do is to assess if the child is arousable. You may do this by calling out to the child or tapping on the child to elicit a response. Are you alright? Are you alright? Can you hear me? So if you're unable to elicit a response, check to see if the child is breathing. Tilt the head, lift the chin to open the airways. You should be able to see a chest rise. If you do not see a chest rise, the child is not breathing. You need to proceed to find the pulse. The easiest way to find the pulse is to find the bony prominence in the neck. Slide your fingers to the side, just below the angle of the jaw. You should be able to feel a pulse there. If you do not feel a pulse, begin CPR. There are two ways to do CPR in children. The first one is to use a single hand method. This is used for children below 8 years of age. The second way of doing CPR is to use a double hand method. So that is used for children above 8 years of age. So for a child who is less than 8 years of age, we use the single hand method. We use the heel of our palm, position it at the lower end of the sternum and compress. For the double hand method, we interlock both our fingers, keep your elbows straight, and again, position your hand at the lower end of the sternum and compress. Compressions should be at about 100 to 120 compressions per minute. We do a cycle of 30 compressions followed by 2 rescue breaths. Each compression should be at about 5 centimeters in depth. So 25, 26, 27, 28, 29, 30. Proceed to give the rescue breaths. Each rescue breath should be given over 1 second and you should be able to see a chest rise. Continue with compressions. You will need to do this for 5 cycles before you check for the pulse again. Once you've completed 5 cycles of chest compressions with 2 rescue breaths, proceed to check for the pulse again. Similarly, find the bony prominence at the neck, slide your fingers to the side and try to feel the pulse just below the jawline. If you're still not able to feel the pulse, call for help and continue with CPR. You will need to continue with CPR till help arrives. In the latest 2010 AHA guidelines, if you're a layperson and not CPR trained and you're not comfortable giving rescue breaths, you may continue with just chest compressions and you will need to continue with chest compressions until help arrives. Thank you.